the state of the nation.
On the 30th of January 2020, the World Health Organization declared a public health emergency of international concern, and on the 11th of March 2020, a pandemic. The COVID-19 pandemic has had a devastating effect on our livelihoods, how we work, how we interact, our decisions too. It has affected inter- and intra-governmental engagements, corporate marketing strategies, family engagements, friends and all. Since then, family after family has been devastated by the loss of one or even multiple loved ones in just a matter of days or weeks. The virus totally changed every part of our lives. When the pandemic hit, our health delivery system was not ready to cope. COVID made things worse. In February this year, Zimbabwe launched the vaccination campaign. How has Zimbabwe done so far? How is the vaccine rollout plan supposed to work? What have we done well? What have we handled badly? Let's take a look at all of these questions. On February the 16th, 2021, the Ministry of Health presented its vaccine rollout plan to Parliament. 2 days later, Zimbabwe launched its vaccination program. Vice President Constantino Chiwenga stepped forward, becoming the first person in the country to get the vaccine. The vaccination program is the main weapon now in our fight against this virus. It cannot be denied that Zimbabwe has done more on vaccines than a lot of people expected. Few gave us a chance, but so far there has been some progress. So let's start with the things that we have done right. Number one, the first thing that we did was to prepare early. Here's what happened. Between October and November 2020, Zimbabwe conducted what's called a baseline readiness assessment. This was a study to find out how ready we were to roll out vaccines and also what vaccines would be best for us. Who did this study? There was a group drawing from various agencies in the country. It's called the Interagency Coordination Committee on Immunization and the Zimbabwe Immunization Technical Advisory Group. It's quite a long name, but in simple terms, it's a committee made up of various experts. They advise the government on all immunizations, that is those from government and those acquired outside the government. So early on, Zimbabwe was looking at how best to get vaccines into the country, which vaccines to get, and how to distribute them. This committee found out that it didn't need to reinvent the wheel. Zimbabwe already has a distribution network for other vaccines. It's called the Expanded Program on Immunization, or EPI. It's like a map of how to get vaccines from the airport to the big warehouses in Harare, Victoria Falls and Bulawayo, to provincial warehouses and right down to your local clinic. They do this all the time with other vaccines. So they figured this network will be the backbone for distribution. So being prepared was the number one thing we did right. Secondly, the government welcomed private players to help in the acquisition of vaccinations, the resuscitation and rehabilitation of our health systems. Players such as Solidarity Trust Zimbabwe, Secunda, INSCO Group, the NGO community such as ZRBF, many SMEs who contributed with the little that they had. The third thing we did right was to make our orders really early. Zimbabwe did not only wait for donations. Don't get me wrong, there's nothing wrong with getting donations from friends. But you need to be the one taking the lead, and that's exactly what Zimbabwe did. While donated vaccines were the first to arrive, purchases were being made. Now, a lot of people say, but we're relying on donations. While the donations are welcome because every bit helps, to say Zimbabwe is relying only on donations is simply not true. Here are the facts. As at the end of June, Zimbabwe had brought in 2.26 million vaccine doses. Of these, 1.7 million had been bought by Zimbabwe. 560,000 were donations. How did this help us? Well, by not waiting entirely for donated vaccines, we were able to avoid a big problem that many countries around us are facing. There is a global shortage of vaccines. It's not easy to get them. There is a global facility called COVAX. It's meant to donate vaccines to some of the poorest countries. It's a great idea, but there have been a lot of delays in getting these COVAX vaccines to many countries. We are seeing this in the region. Even for those who buy vaccines, it's not that easy. It's not like ordering a pizza or buying bread at the supermarket. There's a long queue of countries waiting to buy vaccines. So there's a long delay between the time you pay for the vaccines and the time you actually get the vaccines. Any vaccine that lands at the airport is a major win for Zimbabwe, whether donated or bought. And the last thing Zimbabwe has done so far is being flexible in the rollout. When the program started, vaccines were only for targeted groups. We're talking about frontline health workers, the elderly, our security services, and others. It made sense at the time. We had to reach the most vulnerable groups first. But then, the government decided it made sense to open it to everyone. This meant that there would be less risk of us wasting vaccines. In March, the president got his first shot in Victoria Falls. This was to launch a program to immunize every adult in the resort town. That way, our tourism can have a chance to bounce back quickly. Zimbabwe has been ahead of many countries in the region. Our efforts have been commended by politicians from as far and wide as Australia and even closer to home in South Africa. But should we celebrate this? Not yet. There's still a lot of work to do. Zimbabwe wants to vaccinate 10 million. That's about 60% of the population. This is the level that will give us a fighting chance. So far, we have only vaccinated a little over 5% of the population. What should we do better? Number one, the rollout needs better mass communication than what we have seen so far. There is too much fake news around vaccines and too many fake prophets preaching fake gospels against the vaccine. This needs a much stronger communication strategy. We haven't seen much of this. Recently, a survey by Zimvac asked rural people where they get their information on COVID from. Most said they get it from the radio, but they say they prefer to get it directly from healthcare workers. This should tell the government how best to reach everyone. Number two, the logistics have to be sorted out fast. We have seen people being turned away at some centers. They're told we don't have enough vaccines. Given the vaccines we already have, this should not be happening. It's happening because our logistics guys are not distributing vaccines as well as we know they can. There are areas with high demand for vaccines and places with low demand. This is what those running logistics should be looking at. Nobody should ever have to be turned away. Number three, data. We need data. We want to know where vaccines are being distributed. We want to know of those in hospitals, how many are vaccinated. We want to know how the vaccines are performing. We have the tools for this. One of the teams in place is the Pharmacovigilance and Clinical Trials Committee. These guys check out how the medicines we use in Zimbabwe are working. We also know that the Medicines Control Authority of Zimbabwe is also monitoring the safety of vaccines. Did you know that there's an app you can use to send them any side effects? If all this data is made available, it helps build confidence in the program. So what can we do better? Communicate better, distribute vaccines better, and give us more data. As a country, we must be proud of how we have started on vaccinations. We must give ourselves credit. We have used our own resources to buy most of the vaccines we are using. We have made the right calls on vaccines. We must not celebrate too early. Let's use that positive energy to push ahead and deal with the areas that still need more work. As we battle the third wave, a fresh batch of vaccines were received from China and vaccinations have resumed. Do not wait until the last moment to get in line. We are tired of seeing loved ones sick and dying. Let's support our vaccination program and make it work. Vaccines are our best chance to beat COVID-19. Remember, mask up, sanitize, and maintain social distancing. Like, share, comment, and subscribe.